Never done.
You got to try.
You never did magic mushrooms?
No, nothing.
Well, you got to try it, man.
So
what about acid?
No, nothing.
So you got to start.
Nothing.
You got to unlock the dormant parts of your mind. I think you would have a breakthrough.
That comedian Eric Andre there from Adult Swim. He tried to get me to try every drug possible. I caught up with him at South by Southwest. Our conversation also prompted tonight's chat for Angela After Dark. We're diving into the potential benefits of microdosing. Once again, that's microdosing, which involves using a low dose of psychedelics. Dr. Angela Jones and Dr. Jasmine Boone are both here. You brought a guest with you, Dr. Jones.
That's right. Another expert.
So when we talk about psychedelics, what are we talking about specifically for those who are like in the weeds about this?
Usually when we're talking about microdosing and psychedelics, we're talking about the mushrooms, LSD, MDMAs, which is what we call Molly. So those are the ones that usually are used in regards to microdosing, and also ketamine, which is actually something that's legal here in Texas.
Now, are those all natural or it varies?
No, so it does vary. So LSD is not a natural drug. Psilocybin, which is the mushroom, that is natural. It's a mushroom that grows out of the ground. So that's something that nature has given us in regards to psychedelics. MDMA, Molly, is another one that's chemical as well. So,
and Dr. Boone, would you ever tell anyone to microdose?
Yes.
Really?
I am so for microdosing.
I don't know her at all.
You don't know me.
I am so for it. I'm hoping that we get some more off-label treatments like the like the ketamine, like the psycho, all that good stuff. I hope that we get more of it, because it's really an alternative method to therapy that can really open the client up. It's for those clients who have been dealing with depression, but they're kind of resistant to more traditional treatment methods. This is an alternative method.
And so how would it help for someone who is dealing with depression?
Yeah, so exactly that. So if we are, as therapists, doing everything that we can to work with this depressive client, and it's just kind of not working, they're a little resistant to the treatment, this allows them to go deeper into themselves, kind of let those guards down, open up, less inhibitions, and so you get to have that healing agent that you've been looking for.
And Dr. Jones, would this be better than prescription drugs that some those who may be in psychology, psychiatry, may give to their patients? Would you say it's better than or an alternative?
I think it's more of an alternative.
Yeah.
So usually what they say is that if you have failed traditional Western medicine, like antidepressants or anti-anxiety medications, that this is something different. The only problem is it's not really legal in a lot of places. So to try to get it done like here in Texas, it's not really something that is open for us to get or to get at a prescribed to us or anything like that. But a lot of people are doing it in other states and other countries, have done a lot of research on it, because microdosing is, when people think, oh, you're taking psychedelics, they're thinking we're taking like a whole mushroom, but really what it is, it's only like 1/10 of a serving that you're taking. So what it does is opens you up without like the psychiatric, the hallucinations, without that part of the psychedelics.
And could you at some point overdo it? We can overdo anything.
Right.
But can we overdo microdosing and just go too far?
Yeah, well, because the thing is, unfortunately, research is still out there about it. In the 50s, they were doing a lot of research with psychedelics, with depression and anxiety. Then it came the war on drugs, and it was wiped out. So we are decades behind on research in regards to how psychedelics affects us, the dosing, the right amount, which type of mushrooms, which type of LSD to take. So we're really behind on the research, but so far, the other countries that are doing things like that are realizing the benefits of how this opens people up, and it's a hard way to describe it, but it opens you up to discover yourself in a different way.
And Eric Andre said that as much in that interview. So Dr. Boone, when you're doing your shrooms and your LSD,
we didn't say we was doing it. Clarify.
I'm joking. So for those who are interested, though, where do you find it?
Well, again, this is not legal, right? This is not legal, so I don't know where to find it. Okay. Now, when we're talking about ketamine and assisted, ketamine therapy, that type of thing, there are some clinics that you can go to in the Houston area. Field Trip is one of them, to be assisted in the microdosing, and so this isn't recreational use.
Right.
This is assisted. We're watching you, we're guiding you through it, that type of thing.
And Dr. Jones, I forgot to ask you, do you agree with this or not? I didn't ask you that.
I actually do. I do when you have the right supervision, you have, the people that are guiding you through the process. People do it under medical supervision, and some people do it recreationally. If you do it recreationally, we don't know what's going to happen to you. Okay, so, nobody could be responsible for you. But if you have scientists with you or a therapist with you to help assist you through this process, then I totally agree with that.
And really quick, can weed be microdosed? Marijuana?
Oh, no. Not legally.
Not
That's right. And Dr. Boone does not do drugs.
I do not.
I was just joking.
Absolutely.
We'll be back with more facts.